Hello, I'm Michelle Levander, Director of the USC Center for Health Journalism. Thanks for joining us today and welcome to our Health Matters webinar covering coronavirus when kids miss out on school. With coronavirus cases soaring across the country, school districts are caught up in an unprecedented dilemma. Should they reopen school in person or not? Administrators, under intense pressure from all sides, are being forced to weigh the health of their communities against the well-known benefits of attending school. And then there's the question of funding, with President Trump threatening to withhold school funding from districts that don't reopen in the fall, pitting the federal government against states from West Virginia to California. In this webinar, we'll explore together the costs of missing out on conventional schooling and the deep shortcomings of remote learning. We'll look at consequences for preschool children, students with learning challenges, and kids whose own families have been hit hard by COVID-related setbacks. Here to help us understand the issues at play and possible story ideas, we have three distinguished speakers. Tonnelle Hobbs is the national K-12 education reporter for the Wall Street Journal. She's worked at the Journal since July 2016, and before that was an education reporter at the Dallas Morning News for 16 years. Before starting her journalism career, she served in the U.S. Air Force and the Texas Air National Guard for about 10 years. She also has taught computer-assisted reporting at the university level and earned a bachelor's degree in journalism and communication from the University of Texas at Arlington. Professor Stephen Barnett is the senior co-director of the National Institute for Early Education Research and Board of Governors Professor of Education in Economics and Policy at Rutgers University. His work focuses on public policy for young children and their families, especially early education in the US and globally, and the economics of cognitive development. More broadly, he's interested in how economics helps us understand the determinants of healthy development at both the individual and societal level. He earned a bachelor's degree in economics from Kenyon College and a master's and doctoral degree in economics from the University of Michigan. And then we have Joel Cisneros, a licensed clinical social worker and the director of school mental health at the Los Angeles Unified School District, the second largest district in the nation. He leads one of the largest school district mental health departments in the country with a staff of more than 500 school social workers. He has dedicated his career to advocating on behalf of the role that mental health and school emotional support play. And he has served on committees across different sectors of public education that have developed programs and shaped policies aimed at mitigating the psychosocial stressors that interfere with children's ability to reach their full academic potential. This webinar is made possible by the generous support of the Robert Wood Johnson Foundation, the California Endowment, the National Institute for Healthcare Management Foundation, and the Commonwealth Fund. You can tweet about this webinar at the hashtag #SchoolReopening. Because we have several hundred people on our call and our program today, let me tell you a little bit about our format. We'll be hearing from our panelists first, and then we'll turn it over to our audience for questions. Because we have many people participating in the webinar, we'll ask you to write your questions into the Q&A panel of Zoom, and you can also write us there if you're experiencing technical problems. We'll be archiving this webinar after the program on our website, centerforhealthjournalism.org. And now let me turn to Tonnelle, just to get us started and sort of paint a broad picture. You've been reporting on this really fierce national and local debate over whether K-12 schools should reopen. Give us an overview of where things stand. We're seeing more of a patchwork than a cohesive national policy. And what are the forces pulling school leaders toward reopening, hybrid plans or remote learning, and the costs for each of these options?
Well, you know, many school districts thought that they could reopen to in-person and remote learning. So they thought we'd do in-person, we'll do remote, and we'll give the kids an option and the parents an option. But what they're finding is that we have these coronavirus hotspots now just kind of blowing up all over the country. A lot of these districts are having to kind of redo their plans, and now they're thinking, you know, we need to just open up to in-person learning. So we have districts scrambling right now because they thought they'd be able to offer that in-person option. But I see a lot of districts across the country now pushing back at least 6 weeks to the in-person part. And they'll, many of them plan to start on time, but just with remote learning. So there's a mad scramble going on right now. And then there's obviously concerns about virus spread. So we got districts reconfiguring classrooms, making sure everybody has PPE, trying to get information out to parents. Teachers are very, very, very concerned right now about catching the virus. We have a lot of older teachers that are especially concerned. So right now, they are really just kind of more so now focused on remote learning opening. And obviously they have to make sure the technology's in place. They're trying to take this summer to get, make sure all the students can get online and have devices. They want to give the parents a little training in some cases because remote learning was very difficult in the spring. And they obviously want to make sure teachers are trained. So there is just throughout the country, there's just a mad scramble just to get ready for a fall reopening right now.
And how ready or unready do you think these districts are, given just the enormity of what we're talking about?
Golly, that's a good, I think that they will be obviously more ready than they were in the spring. There was the mad scramble to go to remote learning immediately because of the pandemic. So they didn't have a lot of time to react. I think a lot of districts did take the summer to work on the remote learning programs. And I think most of them a lot of them feel that it will be better this go round, but there still are challenges and there still are concerns making sure students can learn online. But then one of the biggest challenges is too, parents are going back to work, and in some cases they're already back at work. So then what? The last thing a superintendent wants is a 10-year-old at home working, with no parent and maybe even watching a younger sibling or two. So there still are challenges, and I've yet to see any school district say, we are there, we are where we want to be. They are working down to opening day, I think.
Thank you. And Stephen, your focus is on, I'm sorry, one of you going to add something? So Stephen, your focus is on younger children in preschool, and can you give us a sense of how younger children ideally learn and what we've learned from the challenges that we already saw last spring with remote learning, and just give us a sense of what a sustained remote learning experience might mean for young children's development.
Well, young children, and that's all the way up through age 8, they learn best through hands-on activities, one-on-one, small groups with adults and other children. That's not just random free play. Our institute reviewed hundreds of studies over decades to see what made preschool programs work. And the answer is intentional teaching one-on-one and in small groups. And that requires planning, getting inside each kid's head, an expert teacher doing that, and also social interaction with the adult and child and among children. So the sustained remote learning experience, it's impossible to replicate that. And the past spring, no one was prepared. Parents weren't prepared. School districts were not prepared. And the vast majority shut down in March. It was just a disaster. And this matters because preschool learning opportunities, as you could see on the slide, they're highly unequal. They're most unequal in home. And so when you're forced back on home resources, we increase inequality. Our public programs were designed to help equalize. They now got both hands tied behind their back if the classrooms are closed in trying to fight that. But we know from research the biggest benefits are disadvantaged kids, but it has to be high quality and it doesn't work. And it's hard to call what you can do when it's not in person high quality.
Yeah. And Joel, you're the director of school mental health for the LA Unified School District, which is the second largest district in the country. What kinds of consequences have you seen on the mental health of young people, especially teens who are already struggling in school when COVID-19 shut down schools in March? I know at one point the district lost track of 15,000 kids, with another 40,000 failing to check in daily online. What does that tell us about the fall?
Yeah, that's a really good question, Michelle. And like Tonell said, we've had several months to start working on this. And one of the items that we really have tried to make sure that we're addressing is making sure that we connect with students and families. And so we've built up several infrastructures to ensure that we start closing that gap. One of which was immediately was a student and family resource hotline, and it eventually became a mental health hotline. And that really allowed us from the mental health standpoint to be able to understand how to connect with parents and families. Over the last several months, we received upwards of 3,000 calls, mainly from parents and caregivers, really asking about mental health questions, asking about basic need questions such as access to healthcare, access to finances. And so that has really allowed us to be able to understand a little bit more what's going on out there, and for families to be able to connect with us. Because ultimately what we want is to make sure that we're there. In the last several months as well, we've been able to also really look at how do we ensure that the continuity of care that we can provide. Because you mentioned, Michelle, some of those students at the very onset, it was difficult to track. But we've really done a great job of being able to understand where people are and being able to distribute resources. I know school sites have already, just yesterday, they were already starting to hold virtual town halls in smaller spaces so that community can connect with their school sites and really start kind of asking those questions. How do I connect? How do I access internet? How do I access technology? And so we're really wanting to make sure that we can support those efforts.
And Joel, even the most motivated kids saw their connection to school kind of dissipate with this switch to online last spring. So have we lost a generation of kids who were maybe on the verge of dropping out? I mean, are we seeing at your district and elsewhere that those kids have just disconnected and unplugged from the schools, or not? And what have you been able to do to help those kids?
Well, I think we can all agree that the best place for children to learn is in a school setting, right? And the best place for them to be exposed to learning and exposed to the social emotional aspects that Stephen was talking about is around kids. And obviously right now that is what's being challenged, not only in our district, but across this country and across the world. So I think it's going to be something that we all speak about, right? About what is going to be the long-term impacts of this. I think from a mental health standpoint, which is the purview that I can speak from, is that we're really wanting to make sure, again, that how do we build opportunities to connect with community and those students, because we know that physically is not an option. So we're really working on building telehealth networks and virtual opportunities to connect either individually, but also at a larger scale as well.
Thank you. And I have a question for all of you. It's been said that school at its best can serve as an equalizer. And while that may not be 100% true, many experts have found that online and remote learning accentuates inequities. Who tends to get left further behind, and what do we know about that, and what are we anticipating in the fall?
I mean, I could start out with that. Researchers have already really started looking at that, and the kids who tend to get left behind are going to be minority kids and poor kids. And that is because those students are more likely not to have internet at home or devices at home. And also their parents are more likely to have been impacted by the economic downturn. So, and I'm actually even seeing that, just from the reporting standpoint and talking to families, that, are not able to provide the internet, or, some of those households, poor minority kids, or poor kids or minority kids, their parents in a lot of cases are working outside the home in jobs where they can't just stay at home and help them learn. So there's a lot of school districts already bracing to, make sure that they, find out who these kids are. Some districts are talking about, doing evaluations like that those first couple of weeks just to kind of know where kids are. And they kind of have a sense of the kids that might be more vulnerable to really falling behind. But, it is a big concern. It's definitely a big concern.
Professor Barnett or Joel, did either of you want to weigh in on this?
Sure, I can weigh in on the young children. I have a few slides because it can get a little complicated. So this slide shows you what in two very simple areas, reading and math, right? What we know is that if you were to look at social emotional development, the gaps look the same between Black and white kids, between Hispanic and white non-Hispanic kids, between low income and non-low income kids. And you can see these gaps are, the smallest one, 7 months in reading for Black children, up to almost a year for Hispanics and low income children. This is what happens if we don't have high quality preschool programs, and half the achievement gap that we worry about is there when kids at the end of high school. Half that gap's there when kids walk through the kindergarten door. So if you could show the next slide now, look at the big reductions we can get. We can close the gap in reading almost entirely for Black, non-Hispanic, and for Hispanic kids. If we look at the next slide for low-income kids, smaller reductions, but those are still big deals, almost a year to half a year just by high quality preschool. And if we're not providing that, those are going to shoot back up, right? So and unfortunately, it's very difficult for schools to erase those later on. And as I said, I could put up an index of a dozen social emotional skills and it would look almost identical to this.
And Professor Barnett, just a quick question. What does UPK stand for on that?
So, sorry, that's I should be clear. Universal pre-K, right? Basically, the question we asked: if every child in America had the preschool programs available in Boston and Tulsa, how would that change the distribution of inequality? And the answer was shocking because the change was so big. But the pandemic has thrown us backwards.
And it's interesting because you're talking about gaps that start in pre-K and persist. And so that sort of begs the question, if all kids are really not getting pre-K because of what we're confronting right now with the pandemic, I mean, are we talking about a learning gap that is going to persist in that same way, well beyond kindergarten?
I think we're probably talking billions of dollars of lost productivity over a lifetime for these kids if they have a year of what happened last spring. And we just can't afford to do that. We have to figure out a better way. And I know school districts everywhere are working really hard at trying to figure that out.
But you know what? School districts are already very concerned about, enrollment in pre-K and even in some cases kindergarten programs during the pandemic. Some of them are already seeing fewer, parents because they haven't, in recent years, school districts have been doing a lot of outreach for early childhood education. I mean, they have really upped their game in that. But now, and as you said, a lot of the focus is on reopening, and I haven't seen as much on trying to pull in, pre-K kids and everything. So I'm wondering about enrollment going into the fall for those
Absolutely
schools.
right. And I worry that parents will redshirt their kindergartners They'll say they could take a year off. That may be a better answer than having a bad year, because they'll get every year. They'll just get it later. But that will create its own problems when they're adolescents and kids can leave school a grade earlier, for example, if they need to support their families because of that, they'll hit the age cutoff sooner. So there are no easy answers here.
And Joel, did you want to weigh in on this question of equity? I know this is a big issue in Los Angeles Unified School District, where you have many children on federal, subsidized lunches and so on.
Right. Yeah. So for us, LAUSD is close to 700,000 students. 80% of our students qualify for free and reduced lunch. And so we know that equity and closing gaps is at the cornerstone of a lot of our work. And so for us, we're wanting to just make sure, again, increasing the ability to have access for families to be able to receive the services is the first thing. One of the things we've added is a hotline where families can also speak about and have questions around enrollment. So it goes beyond just mental health, but it's really also enrollment questions, because a lot of our families are having these questions and they're able to connect with someone that specializes in attendance matters and attendance questions. We also have folks there that can answer questions on vaccinations, because we know that children, if they are going to start kindergarten, granted they're not in physical spaces, but we still want to make sure that kids are being vaccinated. And so that's something that hasn't been talked a lot about as well. So we're trying to ensure that we provide as many of the resources to ensure that we're closing the gaps, and that whenever we're ready to open doors again, folks are able to walk in and ready to go. And so I think those resources are there for our community to access.
And I have a question. I'll start with Tonell, but I'm hoping everyone can weigh in. And this is we're getting such different advice from some really august thinkers on this. And the National Academies of Science, Engineering, and Medicine recently said school districts should prioritize reopening schools, especially for grades K through 5. And you recently penned a story with a headline that said, "The results are in for remote learning. It didn't work." So what do we know from initial data about the learning declines during the pandemic, and what might be the COVID slide for students going forward? And how many kids in America do you think are at risk? You quoted one academic who talked about an academic death spiral from all this, which sounds dire.
Yeah, I mean, we do know that there were millions of students in school districts who had some kind of reservation about their remote learning program, whereas they wouldn't even let them get zeros, even if they did nothing during the shutdown. A lot of school districts do plan on doing those evaluations to kind of see where students are. I mean, I haven't seen, as far as the early grades, I don't know if I've seen districts actually plan their schedules right now based on, making sure the early grades get priority or in the building or whatever like that. But, that report came out, I think last week, so give it time. And you had another part of your question too, towards the end. Oh, about the slide. Yeah, and that certain researcher who talked about the COVID slide, the concern really is how these schools decide to start. Do you go back to March?
Now, for some reason, your computer is muting you. Yeah, there you go. Maybe.
Okay, I'm good. I'm sorry. It was internet stuff. But do you go back to March and start educating kids from there? Because there were some kids feasibly that have not really done any kind of lesson since March. They'll come back in August and September. That's 5 months. So a lot of districts right now are trying to figure out, how do we start? Do we start them back in March, or do we just plow ahead? Superintendents are mixed on that. And the concern is for districts who don't want to go back to where kids left off. The concern is, how do you, like this one, that researcher you're talking about, her thing was like, how do you teach algebra when a kid hasn't learned pre-algebra? So the districts are, really split on what to do. They feel like if we don't plow ahead into the new curriculum, we've already started them behind. So it's a big issue. I hope I answered all your questions there. I'm sorry.
Yeah, and Professor Barnett, you've kind of already touched on this a bit, but this COVID slide and what we do about it. Did you have anything else you wanted to add about that?
Sure. If you could put up that next slide. We're so concerned about this that we did a survey of parents, a nationally representative sample. What went on in the home, what kinds of preschool program support did they get? Almost 1,000 households with children ages 3 to 5. I'm not going to tell you what the results are because they're embargoed until Friday, but you can get if you email Ernie Landante, elandante@near.org on the slide, you can get a copy in advance. The short story is, it was a disaster. There's no way to, and I don't blame anyone for that. No one was prepared. And it is very difficult to meet children's needs. And that's what, with remote support, and not just online. Online is a very small part. But parents who are working, parents who are under stresses from the pandemic in a variety of ways, it's very difficult to just shift it to them, which is essentially what remote learning for young children does. And I think part of the Academy's reasoning was the research does tend to show that young children are not much at risk from being in preschool and other classrooms, especially if you keep them in consistent groups. Don't let them mix. Keep the adults from mixing and keep the adults from crossing groups. There's a set of mitigation strategies. I have not seen anyone present an estimate that says, here's the risk to young children if we go back to, if we reopen their programs, and here's the risk if they stay at home. Because the risk of staying at home is not zero, and conceivably is higher. Because are they really home? How many other people are going in and out of their homes if they're home? And which they are with extended long-term close contact in close quarters without PPE, et cetera. Why isn't even, I don't even hear people asking that question. This is, and I think there's a certain amount of frustration with both the National Academy of Sciences and Institute of Medicine and the American Academy of Pediatrics, that we're really not asking the science-based questions. What do the facts tell us about our options?
And Professor Barnett, for those young children that you are primarily focused on, are you worried more about academic losses or missing social and behavioral development that won't happen from just being together in a kind of structured setting?
For young children, and I suspect Joel would tell you for all children, the answer is never either or. It's always both and. So we're worried about equally about their social emotional development and their cognitive development. Language is a crucial developmental domain for this period. And like social emotional development, it's unconstrained, that it's a very deep pool. There's no boundary. It's not like I learned my letters, I'm done. I learned my language, no. Right? And so the learning losses can be much deeper in things like language, math, and social emotional development. All of this is, language is a component. How many times do teachers of young children say, use your words in trying to social problem solve and understand yourself? To recognize I'm getting angry, put words to that to deal with it. And these are habits and dispositions, learning to think before you act, developing your executive functions important, not just for controlling your emotions and behavior so you don't get in trouble in classroom or disrupt learning, but so that when the teacher wants you to focus on something that you're not necessarily interested in right now, you have that skill. And people have to understand it's not, I don't want to, I'm a bad kid. It's, I haven't developed the skills, the habits and dispositions of doing that, and they're taught and learned.
And question for you, Joel, did you want to weigh in on all this, but also just a question about whether there are sort of developmental moments of opportunity for greater absorption of these sorts of lessons, and is there some concern that those windows might be closed for kids at certain points if they're at home and watching TV all day or something?
Yeah, so I think there's always a concern, right, that if people and kids are not in school, what are they being exposed to? And how are they growing those executive functioning skills and other social emotional opportunities? And so I think for one of the strategies we're working on is making sure that how do we also then fortify parents, because we know that they're going to be at home, kids are going to be at home. So how do we help parents then be able to take on some of these responsibilities and be able to provide their children with some of these skills? So just in May, we started a series of workshops and webinars for parents where we had upwards of 1,300 people attend, and really breaking it down to talking about stress management and emotional well-being. Really then talking about also just opportunities on how to understand resilience, understand emotional regulation, and really helping parents be able to understand these skills so that when they're at home, they're able to start, most importantly, utilizing these skills so that they themselves are able to stay regulated, because we all know, especially I have young children at home, how difficult it is trying to be a first and third grade teacher and then also having a job and then everything else. So I think it's really helping parents, and I think that's one of the pieces that we're working on as a department in LAUSD, is focusing on parents, because we want to make sure that parents are feeling well and are having the resources available.
And Joel, your district has invested a lot in school health and co-located full service health clinics and done a lot around mental health across the district. But I imagine a lot of those services are harder to access. What are those just shuttered, or are you continuing in business with all that?
Well, we had a very quick turnaround to ensure that those services continued, right? So we had our schools shut down in mid-March, and we had continuity of care plans that were developed in a matter of days. We had about a couple week leadway to kind of start planning and thinking of, what would happen if we closed. And so that was very, very good that we had that opportunity. We were able to, we have close, like you mentioned, Michelle, we have 13 operated brick and mortar facilities across the district that are community-based mental health clinics. And so we had to lift all of those resources up to a virtual setting. So we have close to 2,000 students and families receiving mental health services at those facilities. And now every single of those students was connected and was able to see their therapist via telehealth. So that's been our big lift in the last few months, being able to establish telehealth, HIPAA compliant platforms that ensure confidentiality and ensure that we're supporting the needs of those students. We have, along with our therapists, we also have psychiatrists that provide medication support when necessary, and that has continued. So we're feel very satisfied at this point that we have been able to continue to meet the need. We continue to assess and ensure that we are being able to connect with students and families, and so we're feeling very happy right now with where we are. Obviously, there's always room for improvement, and we're constantly evaluating that too.
And so now I want to turn to you and then maybe have Joel and Professor Barnett weigh in on this question too, about other categories of kids who seem especially vulnerable. I'm talking about special needs kids and also homeless young people and foster youth. What are you seeing on how they're faring? And Joel, we welcome your feedback on that as well.
You know, those kids are even worse off. I've heard from a lot of special education programs. I mean, parents. The IEPs aren't really being followed. There's some kids that require one-on-one instruction. That's not being done. And as for the homeless kids, and I'm sure Joel could talk to this, they're simply just missing in some instances. They don't know where they are, how to get in touch with them. So those students you mentioned, the big concern there, especially with the special education students. I know there's even been some lawsuits filed against school districts from special education parents because they are not getting those services. But, you know, school districts are just saying, we just can't do it right now. And other than safety, they're saying they don't really, feel comfortable sending parents to homes or sending these instructors out to parents' homes. But those are big concerns. And then with the homeless children, like I said, in some cases, districts are just trying to figure out where they are. A lot of those kids don't even have good contact information on file. So there's a big concern that those kids, they will lose them. And they're hoping to, have them, get them in the fall. But I do notice that the getting the homeless kids was a giant concern, and it still is. And a lot of districts are taking the summer just to try to find some of those kids.
And Professor Barnett and Joel, did you want to weigh in on this?
I think you raised some really good points, Tanya, and I think for us in LUSD, and particularly in mental health, we do have a group of our staff that work with students that have IEPs and have mental health services as part of their supports. And for us in that capacity, every one of our staff has been able to connect with students. We've been able to have virtual IEPs, and I know staff have
Oh, and by the
participated.
way, that's a individual education plan, right? An IEP.
Correct. Sorry. Thank you for correct.
And how do those normally work in the best of times?
Well, they happen in person, right? And in a good old fashioned round table, and everyone sits around and is able to share. And it includes a parent, it includes the teachers, it includes an administrator, it includes essentially kind of this group of people that are there to support that child and ensuring that whatever needs are identified based on testing, based on whatever other needs that child is receiving those supports. And so that now is happening in a virtual setting. And from what I've heard from my colleagues is that it's actually worked out quite fine. However, I think there always will be this disconnect potentially, right? With some families, if they don't have access to technology or they don't have access to internet, what happens to them? And so I think there still is that commitment. The district is, again, talking about like ensuring to give technology and hotspots so that people are able to access technology. And so for our staff, they've been able to connect with those students. And I think there was a question also about the homeless students as well, where LUSD is fortunate to have a unit of counselors that works primarily with homeless youth and foster youth. And so we have some dedicated resources to be able to kind of support those students and try to find them and identify them and connect with other county agencies that are working with them. And I know those strategies are in place as well.
And how many homeless kids do you have in your district, and how many of them have you lost track of?
There's close to 20,000 homeless youth that I qualify for homeless, self-reported homeless youth. And so that's the number that we have.
And how many of those have you lost track of with the COVID shutdown?
I don't know that answer to that question. I think my colleague would, in a different department, would understand best what that is.
Okay. And before we open this up to everybody in our audience, I know, Tanel, you had some story ideas, and I wanted to turn to you and see if you wanted to share some of those.
Sure, I'll be really quick. I know we're probably pressed for time, but I did come up with that. That'd be great. Thank you. Yeah, this is just especially for the journalists, just something to look at, reopening storylines. Right now, a lot of districts are scrambling to get their PPE in place, so look for spending for that. How they're buying that. They are hoping to get some federal government help on that. Social emotional mental health care needs. Look to see how those districts plan on addressing that. I have noticed already that districts are planning on really kind of focusing on that in the 2 weeks. It'd be interesting to see how they plan on going about doing that. Additional academic support. There's a big focus right now on definitely getting kids caught up. And some of that they will determine that once they touch base with the kids and see who might need that additional help. Look at their plans to deal with positive COVID-19 cases. Right now, that right there is probably one of the biggest concerns with parents, sending their kids back to school for in-person learning. And the thing about that is a lot of districts are kind of coming up with similar plans, but is it once a certain percentage of the school, if they're infected, do you shut down the whole school? So a lot of plans I'm starting to see are very detailed with the protocol or the plan to deal with positive cases. Protocol for dealing with sick children. I've noticed some districts already are coming up with these so-called like isolation rooms, and these would be for kids who have COVID-19 symptoms. Some parents have mixed feelings about that because if their children has the sniffles, they might not want them in a isolation room with kids who just might be COVID-19 positive. Distancing students, how do you do this? Everybody, especially the teenagers, and I have one, they're ready to get back, they're ready to see their friends, and school districts are already coming up with ways to kind of keep them from just running up and hugging each other or doing whatever. So check with your districts on that just to see what the distancing plans are. There was a district in Montana that opened up for the last couple of weeks of the spring. And one way they kept the really little ones, the kindergartens distance, was they gave them all hula hoops. And it was like, this is your space. You do all of your, your games and your learning right here. So the hula hoops seem to be working for them. And then also look for obviously budget cuts because of the economic downturn. Districts are wrestling with that. Look at the reserve funds. Districts definitely are starting to tap into that, and even in bond fund just to pay for some of these extra costs, like especially with their technology. Child care issues is a giant issue right now, and I fear that is not being discussed enough because with in-person learning, parents are back in work, with remote learning with parents back in work, and even some of these hybrid schedules, what about the childcare? I've noticed some of the smaller districts actually looking at possibly opening up in-district childcares. So that right there is interesting, but parents would obviously have to probably supplement some of those costs. And the last one, teacher absences due to COVID-19. There is a fear by some districts that their substitute budgets will go off the roof because, mind you, they already bracing at any given time. You can have teachers out on quarantine or whatever. So those are just some of the storylines I wanted to share, especially for journalists out there to be aware of. Thanks.
Thank you, Tonell. So we're opening this up to everyone's questions. We have a couple already. Just want to remind everybody that you can just type in a question into the Q&A field at the bottom of the Zoom screen. You just move your cursor down, and we'll try to take as many of them as we can. We have one to start from Rachel Monahan, who says, are any districts talking about bringing kids back based on need, either socioeconomic or school performance, given that there's a need in most school buildings to reduce the number of children on a given day for safety reasons?
Yeah, that's a good question. There's definitely talk about that, about maybe bringing the kids back who might really need more hands-on instruction, and also looking at kids who are in the situation where they don't have the technology at home. So there are districts that are starting to try to prioritize along those lines. That's a good question.
We have a question in my affluent area. Oh, I'm sorry, Professor Barnett, were you going to answer that too? Okay. In my affluent area, parents are discussing on social media their plans to supplement remote learning with tutors working with kids in social bubbles. It seems like this practice will create an even larger gap between high and low income students. How can school districts make sure their students with fewer resources have access to similar resources?
Well, I guess I could do that one. We just did a story on that. There are, parents coming together to hire private tutors in these so-called learning pods. And there's a big concern right now with that, really bringing in many more inequities and possibly, really, impacting even further the achievement gap. I don't know, to be honest with you, if school districts have an answer to that yet. And, but it's on the radar for sure that some parents are just, hiring private teachers, and they're going in with neighbors or other parents, and they're having these pods. And, and there is fear that it would, it would definitely add to the achievement gap, because you would have obviously students whose parents could afford to do that. They would probably be getting, they'd be learning to an extent, getting more one-on-one hands-on instruction. And then you have students who could feasibly be at home alone, trying to navigate remote learning on their own. It is a big concern. It's a big concern in the education world amongst superintendents, but I have not yet heard how they might counter that. I haven't seen anybody yet kind of reach out to any pod saying, hey, since you're doing this, maybe, you wouldn't mind if we put these resources across town. So, but it's definitely one to watch, because that is kind of becoming a big thing on these pods.
Yeah, I agree. I think there's a question about whether school districts, if it's going to happen, could help organize it so that it isn't just for rich kids. And of course, if you reopened in a safe way for young children, you'd at least take some of the pressure off that. It's different with older kids who are more at risk. But boy, it's a tough problem to figure out. My nightmare scenario is that schools do not physically reopen, And their teachers are running these pods off the books for the rich kids. That, but why wouldn't that happen?
That's a good point. There's already talk in school districts about the possibility that they might not be able to open in person. A lot of superintendents are kind of hesitant to make that declaration right now, but they're already kind of thinking about it. That's why they really want to beef up these remote learning programs. And just think, if schools do reopen, they know that there's going to be periodic shutdowns. Any superintendent I've talked to has said it's not if a kid catches the virus and comes to school with it, it's when. They know it's going to happen. They know there's going to be sporadic shutdowns. Do they eventually just say, hey, there's too much upheaval. We're in school. We're out of school. We're in school. What do we do? But they're already talking about that. It's already, I don't think too many people have been bold enough to say we just might not go back in the fall at all, but it's on their minds.
And Tonnelle, that brings me to the question of what would a safe school reopening look like? And is that even possible?
Oh, wow, that's a good one. For a superintendent, actually, I've dealt with a couple, just kind of asking about, what would be your ideal situation? And their ideal situation would be to basically have students in, to keep them literally in cohorts of maybe up to 12, no more than 15 kids. These kids would learn together. These kids would eat lunch together, preferably in the classroom. They would take their potty breaks together. So then if there's a child infected, they could kind of say, oh, this is our cohort, let's isolate them. But unfortunately, you have this situation where, they're kids. They're not always going to be up on PPE or hand washing, for so many seconds and all of this stuff. And some of them will, they might go to the bathroom on the other side of the building, or, they might stop here or there. So the fear is that, although ideally you would keep these cohorts always together and kind of even in the same classroom, bringing the teachers to that classroom to them, they know that these kids will, after school they're talking, during school, they think it's going to be harder to keep them separate. And there's already some teachers who are just very fearful, they don't want to be held legally responsible. They've already said, we're not going to be able to do this. And how do you keep a mask on a kindergartner? I mean, so there's all of these questions, but ideally, their schools would operate in tightly knit cohorts where these kids literally only interact with each other. So if there is a positive case, then you have that cohort where you could say, okay, you guys need to isolate versus shutting down your whole school.
And as we talk about this, I want to turn to Joel and ask you, you're getting a lot of calls on your hotline. What were some of the kinds of challenges that some of your families were already confronting in Los Angeles, and what are you hearing about what they have to juggle in order to manage even a remote return to school in terms of being frontline workers and leaving kids home alone? So what are you hearing in that regard?
Well, it's a whole range of concerns, and it's all the way from losing a loved one to losing a job, to not having access to healthcare, or worried about being evicted. So it's really a whole range. And I think at the core is really people having a hard time managing the stress of this, coupled with kind of the uncertainty of this too, right? I think a lot of people were holding hope that that we would be opening in the fall, and for LAUSD we won't. And so I think there's been this constant hope, right, that people have been trying to say, well, let's just wait then. And so I could see it happening again now. It's like, okay, well, maybe second semester, or come January. And so I think it's really managing the stress associated with this is a lot of what we've been dealing with. And so for us, it's really, again, being able to kind of just be there with community and families and staff to really help students, because we also are helping staff as well, because a lot of teachers are also, they've never taught remotely, right? And so there were a lot of questions around also like, well, how do I connect with this child? Or there was something concerning that I saw with this child, like, help me, what do I do? You know, when they were in the classroom setting in a physical school, they knew exactly where to go to, you know, go seek the counselor, go seek the social worker. And so now it's just completely recreating a virtual crisis response team so that teachers and school site administrators know what to do.
Could I offer an example from Newark, New Jersey, shout out, because I see very few places taking a scientific approach that is using science to figure out how to implement schools in a situation where we don't know the answers. What did Newark do? Newark started piloting how do we get the elementary school and preschool kids back to school in the summer. They got volunteers, parents who said, my kid needs to be back, I'm willing to do this. They did it on a very small scale in a few elementary schools by New Jersey standards, not by LA standards. It's a big district, the largest city in the state. We tried it out a few places. Let's work out the kink, see if we can get this right. If we don't have any problems, then we can show parents that it worked. We can show teachers that it worked. If we make some mistakes, we can fix those before we've tried it on tens of thousands of kids. And by September, we'll know what we're doing, and we will have demonstrated to parents and teachers that we can do it. To me, that's really, if there's so much uncertainty, why wouldn't everyone try that? And if you're going to start up school soon, again, it's not bring everybody back or not. Let's pilot it some places that are willing to do it, see how it works, and gradually move everybody that we can back step by step.
We have a question. How has distance learning affected older students, such as high schoolers or seniors who are preparing for their life after graduation, accessing resources for financial aid and college applications and so forth?
I mean, I guess I can take that one. Just looking at the seniors in the spring, it had a great impact on them. I mean, obviously, in your senior year, they lost a lot, you know, not just prom and having a commencement exercise, but it was a lot dealing with college. I mean, I had talked to some students who actually made the decision on which college or university they would attend without even doing a site visit, which is almost unheard of. So they were having to make those kinds of decisions. I talked to students who had decided that they would either start at their community college since they were going to be at home learning anyway, or just maybe sit the fall semester out. And the fear with that is that, you know, you have some kids that, you know, researchers feel that do better when they go from high school into college. The fear is that some of these kids that graduated, maybe they'll just start working or that they won't go to college. So there is a fear about losing some of them that way. And there's still concern about the 2020 graduates, just kind of how they're doing, what their plans are. They had their senior year, you know, for a lot of them, it was just shattered. And even college, a lot of them can't start college in person. They can't do the things that traditionally you do going off to college and moving in the dorm and getting acclimated and things like that. So there's still concern about those students. I still see districts even still reaching out to them just to see how they're doing, and they're already technically graduated.
We have a question from Herb White who asks, what are the risks for school districts that opt for a hybrid model of in-person instruction and remote? Is it making the best of a bad situation or potentially a contributor to hindering students' development?
Well, certainly for young children, it's a big problem. And it relates to another question that was asked about one district decides to do it, another district doesn't. Then, right? So this is, I think, a good story idea that from an economic angle, there's a lot of sub-optimization. What that means is organizations, people, school districts are making decisions based on their costs and benefits, not on the big picture. And so they make the wrong decisions from a big picture perspective. They shift costs. The schools are shifting costs to parents. Other organizations are shifting costs to schools. Schools that just say, well, somebody else will take care of the child care problem. That's on parents, that's on child care, may make things worse. And from a district perspective, you have school districts faced with the problem that we decide to stay open. The surrounding school districts close their classrooms. Now our teachers' kids are home. How do we deal with that? Do we have to hire the Y to provide care for them? Do we somehow get a change in the regulations and laws so that the teachers' kids can go to our school, even though they don't live in the district? And that's just one of, there's got to be dozens of different aspects of this where if reporters don't cover the story of what's getting lost when states, agencies, local agencies, parents, this is really a version of the protect my own bubble problem. They make a decision based on their costs and benefits and not the big picture. We end up in the wrong place.
And thank you. I think this might be, I'll let any of you decide to answer this, but it might be more for Joel. From Catherine Novak, she says, are there other responsibilities that come up by seeing students in their homes rather than in the classroom, such as hygiene, abuse, drugs, paraphernalia, etc.?
Yeah, I think that's always a concern. All of a sudden, we're entering and we're seeing what the child and that family are exposed to, and so everything, and all of our district staff go through annual child abuse and awareness training, and so that's something that they always have to think about. So as they're looking into their world of where they live, they now all of a sudden also have to take that into account. And so I think something for school districts and across the country, that's a new phenomenon. And I think that's a very good question because historically, I think for our staff, they're used to being able to deal with parents and perhaps even do home visits. But obviously teachers are less likely to do that as part of the school district employees. And so all of a sudden now they're seeing this. So I think that is something that is definitely something that teachers need to be aware of, and for school districts to consider fortifying their training around reporting practices and awareness.
I can add to that right quick. There's also been concern too, and we saw this early on with some kids getting bullied by other kids based on their surroundings and their background. So I did notice that some districts kind of went to that generic background where you really couldn't, gauge, how a student lives based on what's, their background. And they just kind of went to a standard generic background just to kind of cut out some bullying.
I think for similar reasons that while it may sound silly until you think about it, some of the charter schools, private schools, want the kids at a desk with a uniform on when they're on camera.
And question for all of you, when this school shutdown first happened in the spring, school districts started to play this very essential role of distributing food, and just recognizing that that was something that had become a school role. And now, especially I'm imagining in districts like LAUSD, we've got a lot of parents who are these frontline workers who do have to be at work. And so are districts contemplating taking that on, or is there just an assumption that, as you mentioned earlier, Tanya, a lot of kids are going to be at home alone? And for a district like LAUSD, is there an effort to try and come up with some sort of contingency planning, assuming that that's going to be a large population? So I'd be interested in everyone's response. And I think we'll make this the final question too.
I can give that a go. You mean as far as like students, depending on hybrid or remote, as far as food, providing food to them, is that pretty much?
No, I mean, I'm assuming the food stuff is continuing, but
Right.
this is more the idea that they're going to be left at home because their parents have to go back to work.
Oh, you mean left at home unattended? Well, I mean, that right there is probably one of the biggest concerns with remote learning and using the hybrid. And our large, I've talked to some big cities who, when I asked them if they would be trying to provide some kind of child care services, and I got laughed at because they're so big that it's just not realistic for some of them to do. But that right there is a giant concern. Into a Zoom call with some the Dallas teachers, they were in a meeting with a school board member, and that was a big concern that came up. I need this district to reopen in person because I'm going to need some child care. So, it's a child care is a giant issue right now. And there's obviously belief that to get the economy going, people need to go back to work, but those people, they need child care. So there's that.
Yeah, and obviously in LAUSD, being over 700 square miles, it is, there's so many needs. And, one of the things that our superintendent immediately enacted was 60 grab-and-go centers across the district. And in just the first month, there was over 10 million meals that had been distributed. And so I think that is an ongoing commitment, certainly. Many would say, well, why is the district doing that? Well, because we know that, like I said, 80% of our students qualify for free and reduced lunch. And if those kids aren't in school, then there's a concern if they're not getting a meal. So that's an ongoing commitment that will be in place.
Yeah, this is a great example of where school leaders need to think outside the usual box. There a lot of them are already doing that, but it can go bigger. They have to be thinking about partnering with childcare, thinking about childcare as a service they provide and could be provided in context with others. All of the extracurriculars, music, dance, the visual arts. There are all these artists and arts organizations and theaters sitting around where people are not being productive, facilities are not being used. How can you partner with them to make those things happen for kids so they don't have to be in the classrooms when those happen? And the teachers who need to do other things can do other things while somebody else is doing that. There's so much, there's these unemployed resources all over that the question is, how do we get someone thinking about putting them all together to meet the needs of children and families?
Well, with that plea for more creativity, we're going to close. I want to thank our three panelists, to thank our audience. And we'll be sending all of you a survey about this webinar and what topics would be of greatest interest. And I encourage all of you to fill that out too. And should you want to support this webinar effort, you can do so with the information displayed here. Thank you very much and have a wonderful day.
Thank you, Michelle.